Five of Ontario's largest healthcare unions have written a joint letter urging the Prime Minister to consider the risks that come with the Ford government's new privatization plan. The letter comes as the Prime Minister prepares to sit down with the nation's premiers next month to negotiate healthcare funding. In the letter, the unions, which represent a combined 295,000 healthcare workers, say Ford's plan puts their members at risk. They say the plan would also make it more challenging to retain frontline staff and damage the ability for public hospitals to provide high-quality care. And for more on this, I'm joined by Angela Priocannon, a registered nurse and vice president of the Ontario Nurses Association. Thanks so much for joining us this afternoon.
Thanks for having me.
I want to start right there with what it says in the letter. Premier Ford's privatization plan is putting our members and the people they care for at risk. Talk to me about the problems you see with Premier Ford's privatization plan.
Well, it's certainly lending to a two-tiered system that will not benefit our people of Ontario. Currently, we have a publicly funded system that is broken, and we are urging the government to act on retaining what we have and ensuring that our public healthcare system is adequate. This is very concerning that the government is not hearing us.
So what are you hoping for with penning this letter to the Prime Minister and Deputy Prime Minister?
Well, we're hoping that the Prime Minister goes and speaks to his cabinet about the Canada Health transfer, that we need this money and we need help. And we are urging the Prime Minister to come forward and listen to our needs. The healthcare of Ontario and of Canadians is at stake right now.
Trudeau, the Prime Minister, has invited premiers to Ottawa to help hash out the healthcare deal soon. What are you hoping for this meeting could give not just Ontario, that's pushing for more privatization in the healthcare system, but all the provinces in general?
Well, we're really hoping that we will not have to rely on this new plan of nurses coming to Ontario from other provinces. We're all taxed. Every single province is taxed with a nursing shortage. And so hopefully this will strengthen the ability to keep nurses in their own provinces.
So despite privatization, what can the province and federal government do to help alleviate our healthcare systems and help healthcare workers that doesn't involve privatization plans?
We need to have competitive compensation in all provinces to keep people in their provinces, and they need to address the issue about ensuring that we retain, we return, and we recruit the healthcare workers that are in our provinces.
And with the push towards privatization, you've addressed many concerns about staffing levels. What are your concerns about staffing retention?
At the current state that we're in, with 25,000 nurses short in the province of Ontario, we want this government to really look at how they're going to help us in our bargaining to be able to give fair compensation to retain the nurses that we have.
Registered nurse and vice president of the Ontario Nurses Association, Angela Priocannon, thanks so much for your time this afternoon.
Thank you so much.